Okay, we're getting ready to do a physical examination, a head-to-toe assessment. I'm going to wash my hands. Hello, my name is Laura Saldivar. I will be your nurse practitioner for today. I'm going to be doing a head-to-toe assessment on you. What brings you in today?
Physical checkup.
A physical checkup? Do you feel sick today?
No.
Are you in any pain?
No.
Have you been diagnosed with anything? Any chronic illnesses?
No.
Okay. I'm observing the patient, seeing if they're in any distress. I'm going to make sure that the patient is draped appropriately and we have privacy. First, I'm going to start with checking the vital signs. I'll put on the right size blood pressure cuff. And I will locate and palpate, if I was to do it manually, I would locate and palpate the brachial artery and place my stethoscope there to auscultate. After checking the blood pressure and the other vitals to include the oxygen saturation, the temperature, viewing the respiratory rate, I'm going to palpate the radial artery for 15 seconds. And I'll be watching the respiratory rate for 30 seconds. Moving on to the examination of the head, I will inspect the skull. I'm going to touch you, parting the hair in 3 places, inspecting the face. You raise your eyebrows, frown, close your eyes tightly, smile, and puff out your cheeks. I'm assessing cranial nerve 7. Now I am going to palpate the temporal artery. I'm going to palpate the temporomandibular joint. Fingers in front of the tragus of the ear. Open, close, open, close. I'm listening for any clicking, and I'm also assessing range of motion. Can you clench the jaw? I'm assessing cranial nerve 5. Okay, so the jaw appears to be normal. Okay, moving on to the ears. The external ear, I'm inspecting the external ear, the auricle and the pinna. I'm going to use the otoscope to inspect the auditory canal and the eardrum in the middle ear. I'm going to inspect the ear canal and the tympanic membrane on both sides using the otoscope. I'm pulling the auricle up and back to straighten the canal. Do you feel any pain in your ears? I'm going to assess your hearing and do a whisper test. Plug one of your ears. I'm going to whisper in this ear and you tell me what I said.
Hello.
On both sides.
Hello.
Okay, I'm going to assess air and bone conduction using the tuning fork. I'm going to place the lightly vibrating tuning fork on the top of the patient's head. I will ask where the patient hears. And then I will do the Rhine test. I will place the base of the lightly vibrating tuning fork on the mastoid bone. When the patient can no longer hear the sound, I will place the vibrating tuning fork in the front of the ear and ask the patient to tell me when he no longer hears the sound. Moving on to the eyes, do you wear glasses or contacts? Okay, is your vision okay or blurry? Okay, I'm going to test your vision by using the Snellen eye chart. Placing the Snellen eye chart 20 feet away, and then you are going to read me the print, and I'm going to assess your vision. Okay, so ideally we have the Snellen chart. I'm going to test visual acuity by doing the confrontation test. Okay, I'm going to face you. Look at me with both of your eyes into my eyes. Cover one eye, the palm of your hand. And then I'm going to use my fingers and you tell me how many, looking in my eye with your peripheral vision, tell me how many fingers am I holding up.
2, 3,
Switch to the other eye.
2, 3, 2,
Okay. Now I'm going to inspect the outside of your eyes, external, the color, if there's any drainage, symmetry. Okay, I'm going to test your pupils. I'm going to assess pupil size and shape. Look straight. Look straight. I'm looking for pupillary constriction in both sides. And I'm going to test your extraocular muscles. I'm going to need you to follow my pen with your eyes. I'm going to assess accommodation. Focus on the pen. Look behind the pen, into the distance behind the pen. And I'm observing for pupillary constriction. Now I'm going to check the 6 cardinal fields of gaze to assess cranial nerves 3, 4, and 6. Now I'm going to darken the room and I'm going to use my ophthalmoscope to assess the orange glow in the pupil and the red reflex of the retina, and if there's any opacities in the red reflex of the retina. I'm going to turn the lights off. Okay, now I'm going to move on to the nose. I'm going to inspect the interior and anterior surfaces of the nose. I'm going to use my pen light. Inspecting the inside of the nose, I'll use an otoscope with a speculum. Tilt your head back. Okay. Moving on to your mouth. I'm going to inspect your lips. Open your mouth. Inspecting the mucosa, the tongue, palate. I'm going to use a tongue blade. Say ah. Say ah.
Ah,
To assess cranial nerve 10. Open up. Open. I'm going to check your gag reflex. Put your tongue out. I'm assessing cranial nerve 12. I'm assessing the pharynx and the tonsils. Redness, drainage, cobblestone texture. Okay. Now I'm going to move on to the neck. Sit up straight. Flex your neck slightly forward. Okay. I'm going to assess your lymph nodes. Head up. Palpating the pre-auricular lymph nodes. Posterior auricular, which are behind the ear. Submental, below the chin. Supraclavicular. Stop.
tickles.
Okay, I'm going to inspect the trachea for any deviation. I'm going to inspect the thyroid, head back. Looking in the cricoid cartilage. Palpating the thyroid gland. Flex the neck forward. Feeling for the thyroid isthmus. Okay, swallow. Okay. Okay, now I'm going to move on to the thoracic part of the exam. We're finished with the head. Okay, I'm going to be assessing your rate and rhythm of your breaths. Let me see your fingernails so I can assess for clubbing. Showing oxygen deprivation. Okay. Breathe in. I'm assessing for symmetry. Turn a little bit to the left. Your whole body. Your whole body. Okay. Say 99.
99.
99.
99.
Okay. I'm also going to assess that. I'm going to pull the gown down. Go ahead. 99.
99.
Okay. Say,
99.
okay. And uppercuts. Going to identify the diaphragm on the right and left sides. And diaphragmatic excursion. Inhale. Exhale. Okay, I'm going to place my markings. Okay, I'm going to listen to your breath sounds. Inhale. Inhale. Okay, I'm going to listen to the front. Inhale. Inhale. Okay. Okay, let me do the front, face forward. I'm also going to okay, 99,
99.
99,
99.
99.
99.
Listen to the breath sounds in the front. Breathe in. Breathe in. Breathe in. Deep breath. Breathe in. Breathe in. Okay. Now we're going to move on to the cardiac system. So I'm going to start with your neck and your carotid arteries. Turn your head to the left. I'm looking at your carotid arteries, seeing if I see any bounding. Okay, turn to the other side. Okay. All right. Okay, turn your head to the right. Okay, and I'm going to palpate your carotid pulse. If I feel any diminished, bounding. Don't want to palpate both at the same time. I'm going to auscultate to see if I hear any bruits or murmurs. Then I'm going to move on to the apical pulse, the fifth intercostal space, midclavicular line. Then I'll listen to the second right intercostal space. Left second intercostal space. The apex, the point of the maximum pulse. Now listen, use the bell to see if we hear any abnormalities, murmurs, arrhythmias. Okay. I'm going to move on to the abdomen. I'm going to observe. I'm looking for symmetry, the shape, if there's any bloating, bumps, distension, any discolorations, visible pulsations that could indicate aortic aneurysm. I'm going to listen to all four quadrants. also auscultate the aorta and the renal arteries. Okay, I'm gonna percuss the liver in the right upper quadrant. Okay, try to lay a little bit down more. I'm looking for the lower edge of the liver based on percussion. I'm gonna do soft palpitation and deep. Try to find the lower edge of the liver. I'm gonna push and see if there's rebound tenderness. Do you feel pain in the right side when I push on the left side? Rebound tenderness?
No.
Okay. Okay. Okay, raise this knee. Raise. Okay, do you feel any pain? Okay. It's a SOA sign. Okay, any pain? Okay, that's good. I also am going to palpate the costovertebral angles with deep pressure of the fingertips to assess kidneys and the bladder. Any pain? Tenderness? Okay. Gonna move on to the musculoskeletal examination. You see your hands. Looking for any abnormal joints, deformities. Okay. All right. We're gonna do see if you have carpal tunnel by doing the Fallon's test. So you're gonna flex your wrist at a 90-degree angle. Keep your fingers closed. Fingers closed. Okay, for 30 seconds, and then we would see if you have any numbness. Okay, let's assess. You can put that down. Okay, we're gonna assess adduction and external rotation with your shoulders. You're going to raise both arms above the head. Place hands behind the neck to assess adduction and external rotation. Okay, now hands behind the small of the back to assess internal rotation. Okay. Now reach as high up in the spine as possible, like this. Okay, let it relax. Resist, put your shoulders up against my hands. Okay, turn your head to each side. I'm assessing cranial nerve 11. Go like this, ear to shoulder, ear to shoulder. Don't move your shoulders, just move your head. Okay? I'm gonna look at your spine. If you could stand up, face away from me. I'm gonna assess for scoliosis, lordosis, bend and touch your toes, or kyphosis. Okay, stand up. Okay. And fixing the patient down. Okay. Have a seat for one more moment. I'm going to assess the knees. Okay, flex your knee, other knee. Okay. Flex the knee. I'm testing the Ballottement test. Hand on the suprapatellar pouch. Push down on the patella with the thumb. See if the patella floats or bounces. Other side. Okay, stand up for me one more time. Okay, I'm going to assess your hips. If you could turn the other way. Okay, I'm just going to assess your walk and make sure you don't have any abnormalities. Just take a short walk right there. Okay, very good. Looks pretty normal. Have a seat. Okay, we're gonna do the finger to nose test. So you're going to put your finger on your nose and follow my finger now. Finger. Put back to your nose. Okay, perfect. I'm also gonna assess your reflexes of your biceps. I would hit if I had the tool. I would also do your triceps. Okay. I'm going to do something called to chest graphesthesia. I'm going to draw a letter or number in your palm when your eyes are closed, and you tell me what I wrote. Ready?
C.
Okay, I'm going to put something in your hand, and I need you to tell me what it is with your eyes closed.
Giorno.
Okay, very good. I'm going to inspect the lower extremities for any abnormalities indicating peripheral vascular disease. So let me see the bottom again, your feet. Palpating, looking for signs of edema. I'm going to check the arterial pulses. Dorsalis pedis. And posterior tibial. Okay. I'm looking to see if there is a lack of hair. I'm looking to see if there's any discoloration, wounds, something to indicate that there is compromised blood flow. Okay. All right. I think that basically concludes our head to toe assessment. Do you have any questions? Any concerns?
No.
Okay. Also, for men, it's very important that you assess your testicles while you're taking a shower, ideally when it's warm, and you look for any lumps, bumps, swelling, abnormalities, just as to prevent testicular cancer. So ideally you can do it, every month when everything is relaxed in a shower. You can go and just kind of feel around, squeeze, and be familiar with your own anatomy. That way you can catch if there is any abnormalities. Okay.
Thanks.
All right, well, so we'll get the paperwork filled out for your physical for your job, and you're good to go.